Can nonverbal cues improve schizophrenia communication strategies? Imagine trying to understand someone who struggles to read your facial expressions or body language. That's often what people with schizophrenia experience. Nonverbal cues are a big part of how we connect, but for those with schizophrenia, recognizing and using these cues can be tricky. They often have what is called a nonverbal social perception deficit, meaning they find it hard to interpret gestures, facial expressions, or emotional tones of voice. This can make social interactions confusing or even frightening, especially if they misread someone's intentions. For example, they might see a simple glance or gesture as threatening, which can lead to withdrawal or feelings of mistrust. These difficulties are linked to negative symptoms of schizophrenia, like reduced motivation or emotional expression, and can affect daily life and relationships. Even with these challenges, nonverbal communication still matters a lot in caregiving and family support. When caregivers or family members use positive nonverbal signals, it can help build trust and make the person feel safe. Simple actions like maintaining contact, mirroring gestures, or having an open body posture show empathy and acceptance. These signals encourage the person to open up and share more, making therapy or daily interactions more effective. Training caregivers and family members to be aware of their own nonverbal cues is key. By observing the patient's body language and facial expressions, they can adjust how they communicate in real time. For example, if a person looks confused or uncomfortable, a caregiver can respond with a calm smile or gentle gestures to reassure them. Using clear, consistent gestures and facial expressions helps improve understanding, while avoiding negative signals like crossed arms or distracted looks prevents feelings of rejection. In practical terms, families can use nonverbal strategies like sitting at eye level, using gentle gestures to encourage communication, or giving reassuring facial expressions when speech is limited. Patience is important, especially if speech is delayed or restricted. Responding with supportive nonverbal cues can make a big difference in how comfortable and understood the person feels. Teaching family members to recognize signs of discomfort or confusion in nonverbal behavior allows them to respond more effectively. Overall, even though schizophrenia can impair the ability to perceive and produce nonverbal cues, consciously using positive nonverbal communication can improve interactions. It helps create a sense of trust, reduces misunderstandings, and can support better daily functioning for those living with the disorder.